It's 8:30 on a Thursday, and we've got some wonderful guests in here from St. Anthony Memorial Hospital. Of course, we've got Mike Janis here, who is, I'm going to get this right, the Executive Director of Outpatient and Ancillary Services. How are you doing?
I'm doing well. Good morning.
And Theresa Rutherford, the President and CEO as well. So it's good to have you two here.
Thank you for having us. We appreciate it.
All right, so it's a busy time for hospitals. Sick. A lot of people sick, and you guys doing all right over there, keeping everybody trying to get healthy, right?
We're there to be of service. So when people need us, we're there to serve.
Awesome to hear.
Congratulations on the award St. Anthony's received from the Chamber.
Thank you. It was a great honor. It's always an honor to be recognized within a community. You know the caliber of the businesses in our community. So thank you for that. We really appreciate it.
You bet. Busy time. Flex is right. I hear that from everybody. And how did things go 2019 as a whole?
It actually was a very exciting year. We've been on a journey of continuous performance improvement for our entire history, actually. And 2019 was a great year for us, and we're rolling right on into 2020 with the idea of continuing to improve and meet the services of our community. In 2019, we, of course, we received the Chamber Business of Excellence recognition, which we really very much appreciate and value. We also, though, received the 2019 ILPEX Award, which is the Illinois Performance Excellence Baldrige Award, and we received a silver this time. Again, continuing to advance, and our team and physicians continue to improve the services, and we assess what's going on in our community and continue to adapt and grow to meet the changing needs.
On the ILPEX Award, what does a hospital have to do to win an award like that?
It's pretty phenomenal. They actually come in and spend a week with us after we've submitted all of our data. It's really a lot about showing continual improvement trends and strengthening the way you lead and continue to grow an organization. But the reason we won it is because of the colleagues that we have. Our frontline colleagues every day come in and, punch in at the time clock, and their goal is to make that patient's care better than it has ever been. So it's really all about their work. We just do the reporting.
Absolutely. So it takes a big team to do that,
Yes,
doesn't
it does. Yes, it does. Another way we recognize our colleagues and that they've been recognized is we are one of only two hospitals in the state of Illinois that have received advanced certification for hips and knees. And that means that our team, along with the providers in our community, so our physicians, have worked hard to assure that anywhere in that continuum of care, those patients receive the most advanced care possible. And to be one of two, our team ought to be very proud of themselves. And patients should see that as the ability to make choices about where they get that care. And you always want to go where they can give you the best care possible.
Absolutely, no doubt about it. Well, Mike, it's been a busy year for you, I know. And what are some of these accomplishments over the past year you guys have experienced?
Well, I think the biggest thing is just continuing to collaborate, meeting the needs of our community and partnering with the physicians and the advanced practice providers that provide care. One of the more newer developments is the businesses in our community said we want to provide high quality care and lower our healthcare costs for the people that we employ. So our occupational health and Lead Well clinic is often and running quite well right now, and that was come from the businesses in the community asking to lower their healthcare costs, but they want that high quality healthcare. So in our new building on Temple Street, we have what's called our Occupational Health and Lead Well Clinic, and some of the businesses in the community like the city of Effingham, Sherwin-Williams have signed on to get that service provided, as well as our own colleagues.
I know that was interesting when you had the unveiling. The fact that Steve Miller, the city administrator, was there and different partners in the business community, that's really important to a business. I know we've had a little round of and all that stuff for this last several weeks, and it's important for a business to be able to keep their staff happy and healthy too.
Yeah, and we always focus on meeting the needs of our community, both when you're sick, but also prevention. And how do we help partner with them to make sure you have the healthiest people to provide the services for businesses in this community that are just continue to be remarkable. So to be able to come alongside them and provide something that they ask of us is something that is very mission-based for us, and we're excited to provide it to the community.
As I understand it then, too, if businesses want to know more about Lead Well or things like that, they should contact you all, right?
Yeah, absolutely. You can find everything on our website. You can contact us directly, and we'd love to help navigate that for you, understand what options are there for you, and do an assessment of your business or your healthcare needs and take care of those.
Yeah. By the way, that's a cool looking building, that new medical center.
We are so proud of it. It is something that we're blessed to provide to the community, and as a hometown boy, it's nice to see things grow and continue to provide for such a community that's blessed us in such a way for so many years here.
All right. Well, a lot of interesting things, Theresa. How do you decide which direction to take in growing the services at St. Anthony? I mean, there's many different ways you could go. How do you decide something like that?
Well, we do several things. We do a community health needs assessment, so we go to the people who consume our health care. We ask them what's important to them. What do they need? What have they personally identified? We then put that as a piece of our discernment and looking at all of the things. So not only what do they need, but how do they want to accomplish that care? Much of what Mike talks about in his particular job is what happens outside the four walls of our hospital. It's more and more about being available in the community where these patients live and work. And people want it to be more convenient. And we all do. We're used to technology and innovation that helps us advance healthcare. And now using innovation that we saw elsewhere as ways to help patients get their care is a great thing. I FaceTime with my grandbabies every night, my husband and I do, and that's one of the concepts that now you can use for anytime care. You can go on and FaceTime with a physician or a mid-level and get some of your care done if you can't get into your primary care provider. So it's really about access, improvement of care, and what does that look like? And it changes every time we turn around, and it will continue to change. Innovative ideas about how you do that, and our community helps us pick out what those are as well. We also have a community advisory committee, which we run ideas past them. They help us look at them. They're people from our community and walks of life that may or may not be healthcare, and have them help. We also run things through our board, who helps us look at not only the growth and stability of the organization, but providing for healthcare and health in our community. Also, collaboration with other not-for-profits and other businesses in our community, collaborations with Catholic Charities and Crisis Nursery. We're not in this alone. It's the best thing about being part of Effingham. Our community and the businesses will come together and be stronger together than any of us are individually, and that provides for a better community. It also helps us address some of the things, around the social determinants of health, because health is about more than just seeing your doctor and having an emergency room. It's about how well are we educated? What do we look like? How safe is our community? And when you look at our community, we are fortunate in many of these areas, and together we are stronger.
Yeah, I know that. I'm not sure we've had a chance to visit with you since the emergency department renovation got completed, but we had a family member who had to use the emergency, because it's not like you want to do that, but
exactly.
But we were in there, and I was really impressed with. I know privacy was one thing you were really shooting for with that, and we actually had a space, and that was nice. That's a big change from how it was sometimes in the past, and I think it's working pretty well, isn't it?
It is. We've had great feedback from the patients who have needed to use our service because, as you said, it's a dip in the day when you have to come to the emergency room. It's not something you plan on. And it's meets the needs of the patients. It also helps our staff have a space that can provide for additional privacy and helps them have visual access to patients at all times. And that's really important in an emergency situation. We've also got a team there that continues to grow and strengthen their own level of practice. And they're all working hard together. And last month, they actually met the 99th percentile for patient experience. So
awesome.
Having a good space that lives up to the caliber of the practitioners is a great way to provide services to our community. And that's really what an ER is. You know as well as I do that ERs don't make money, but they're there to be of service because no one plans on that. So we're there to take care of them if they need it, if it's needed.
It's a hectic place, but it's good to keep people at ease and take care of them.
That's
when they
right.
need it the
when
most.
you need it. And that's, you ask about how we decide. We also look at things that maybe have not been provided but are determined to be necessary. So things like telehealth, telepsychiatry. We've been trying to recruit psychiatry into our community in a collaboration for quite some time, but have been unable to do that. And so we brought in a mid-level provider, a full-time mid-level, and she's amazing. But we also have her paired up with a physician who is actually, we use the FaceTime concept. We use telehealth to help do that. And he can actually interact with the patients and help determine what medications they might need, or if there are other services in our community that they can be referred to. So again, it wasn't possible to do it in the most conventional way, but we brought the service with the innovation that's available to us in this day and age.
Yeah. Talk about facilitating in a cooperative spirit. I also want to thank you for hosting the Alliance for a Healthier Effingham County. I get to sit in on some of those, and Lisa Holscher works real hard with that. That's really nice about identifying things that could be done better in the county and how we can go about doing it. It's very useful.
Well, continuous performance improvement is something that every business that wants to have longevity continues to do. And our community has stepped up to do that. It's kind of fun to hear us go from Effingham 2020 to Effingham 2030 and looking at what can that look like in the future.
I know you guys are very open, to questions from the community, always looking for ways to improve and stuff. How's the best way to get in touch with you guys at the hospital?
There's actually all kinds of ways. Depends on what you're most comfortable with. You can go to our website, which is stanthonyshospital.org. And on there's a button called Ask Theresa, and you can put your questions right in there if you'd prefer to do it in that way. You can always stop by my office. It's right by the gift shop in the front lobby, just off the front lobby, excuse me. Or you can call, by all means. I have to always look this number up, 347-1495, because I don't call myself. Or you can also get on my email at teresa.rutherford@hshs.org. Or if you have questions about outpatient services, Mike's available as well, and his email is of the same format.
Awesome stuff. Always good to know you guys are up to doing better and striving for more.
Absolutely.
At St. Anthony Memorial Hospital. Yeah.
I was looking at your awards in the hallway, so see, we all do that, right?
We get lucky once in a while, I guess, so you do what you can. Well, thank you, too, for being here, and continue doing the good work at St. Anthony's, okay?
Thanks very much. We appreciate it.
Appreciate it. Thank you.
Theresa Rutherford is the president and CEO. Mike Janis is the executive director of Outpatient and Ancillary Services at HSHS St. Anthony's Memorial Hospital. Community calendar for